As temperatures rise, vulnerable populations are most at risk of heat stroke and heat exhaustion. But as health officials tell NBC 16, athletes who spend substantial time pushing their bodies in the heat are among the most unsuspecting groups that suffer heat exhaustion.
It's certainly athletes and people that are working outside. Um, it's also the elderly and infants and young children. Their bodies are just not as able to regulate their core temperatures.
They are so fit that they're not necessarily experiencing some sort of heat related illness. So their fitness and their internal drive and strive to really either hit a personal best in a workout or go for that gold medal makes them really at risk.
Signs of heat exhaustion can begin at a normal body temperature, with severe symptoms when the body hits 104 degrees Fahrenheit. At that temperature, it can quickly become heat stroke. Dr. Paula G says people often don't realize how fast heat exhaustion can happen and how dangerous it can become if left untreated.
One minute you're having fun, everything seems fine, and then another minute someone's overheated and they're very confused. They're altered in their mental status, and that's really the main emergency. That's the warning sign. I'm mostly seeing the after effect when someone's really dangerously hypothermic. We're seeing essentially brain injury and kidney injury and organ systems being affected afterwards. So what I like to try to drive home is prevention.
Dr. Wass says the biggest thing for athletes who plan to exercise out in the heat is hydration, but not just any fluid will do.
Make sure that whatever you're consuming for hydration has electrolytes because we sweat a lot of sodium and also carbohydrates.
She says drinks and gels with 5 to 8% carbs stave off heat-related illnesses. Also adjusting training expectations as well as wearing sunscreen, light-colored moisture-wicking fabrics, and a hat or visor and UV-protected sunglasses. Even with prevention, hard exercise and hot temps hold a risk.
If you do start experiencing those symptoms, the brain fog, dizziness, nausea, a clamminess sensation, the most important thing you can do is just stop what you're doing.
Move them into the shade and or get them into the air conditioning, get them some cold water and see if they start feeling better. But if they're confused or, God forbid, if they're having a seizure or anything like that, that is a medical emergency, time to call 911 and also try to start cooling them down.
WAS suggests using ice packs or an ice bath to help bring the body temperature back down to normal. And Dr. Apology reminds everyone that although summer heat brings with it these cases of heat exhaustion and heat stroke, it's typically when the initial wave of heat comes that catches people unprepared.